Hi, I'm Dr. Blink. So, are all dermal fillers the same? The answer is no. There's different types of dermal fillers, different quality of dermal fillers, as well as different consistencies and different areas in which you inject the different types of fillers. So in certain areas we want to create more of a lift, in other areas we want to create more of a projection, like a volumizing effect. So it's important to know that you're using the right product in the right area. Also key is to make certain that the injector who's doing it is qualified, that they're a medical doctor, as well as they've got the necessary experience, that they understand the anatomy of the face, they understand the where the blood vessels are. This is key. Important as well is preparation before having a dermal filler, making certain that you're in good health. This is all about risk reduction. So making certain you haven't had any dental work in the last month, no vaccines like the flu vaccine or COVID vaccine, and then also that you had no flu in the recent months, or gastrointestinal infections, or any infections in the body. The reason for this is you can get nodules in the face, which can develop even up to a year later if you're not in good health. So we want to minimize the risks. So what are some of the possible side effects of fillers? So these are, of course, more rare side effects, but even in the best injector, with like any medication, you can get side effects, but you want to reduce the possibility of getting any side effects. So you can, of course, get bruising, swelling, redness at the site of the injection. Remember, we're using needles, or we're using cannulas, or blunt needles. So if you're sticking needles in the face, like with anywhere else in the body, you can get bruising and swelling. So don't do fillers just before an event. Allow enough time for the filler to settle. Also, the filler takes, when I inject the filler, it looks beautiful, but sometimes it needs a little bit of time to settle before it even looks more beautiful. So it draws in fluid, it evens, it smoothens out, and it just gives a better appearance after 2 to 3 weeks. So continuing with what are the areas, other areas, a key area which I didn't touch on that you can inject fillers is the lips. So lips, once again, I did a whole series on this, but lips can be about smoothing out the lips, hydrating the lips, volumizing the lips, or contouring or creating a nice border to those lips. It's so important to keep results natural. That's why there's a lot of bad publicity out of there, people that have overdone their faces. That's not what it's about. It's about just restoring what you've lost and being the best version of yourself. And that's what's key, as I mentioned earlier. It's about the right product in the right area, the right depth, and the right quality of product. Remember, you get different types of fillers out there. Beware of just injecting any filler. The high quality products that are FDA approved, ask your doctor what filler is actually being injected into your face. How long do fillers last? Fillers can last anywhere between 6 to 18 months. Generally, the lower face fillers last longer because it's a more robust product. And are fillers just for women? No, there's a lot more men doing fillers now as well. And what are the differences? So in the men, they usually want more a square-like chin or a robust jawline. Often I see men coming in as well that have got a volume loss under the eyes, and they want to try and correct and smoothen out that volume loss. Lip fillers in men are becoming more popular as well. And of course, the technique differs between men and women and how the fillers are injected. Most men don't want the pouty look. They just want to actually replace volume loss, or maybe have a very thin top lip that they want to even out the lip volume as well.